Did you know that diarrhea can be dangerous for the elderly? You might be wondering why. Well, let's dive in. Aging, as inevitable as it is, brings about changes in our bodies that can make something as common as diarrhea particularly risky for older adults. The combination of physiological transformations that come with age and an increased susceptibility to complications paints a concerning picture. But why is this so? Now, let's uncover the physiological reasons behind this danger. First, let's look at the physiological reasons why diarrhea can be dangerous for the elderly. Aging brings with it a host of changes that can affect our bodies in a multitude of ways. One of these changes is a decrease in gastrointestinal function. As we age, our digestive system naturally slows down. The production of essential digestive enzymes decreases, and so does our body's ability to absorb nutrients effectively. This can lead to alterations in stool consistency and frequency, often resulting in diarrhea. The second physiological reason is the weakening of our immune response with age. A robust immune system is our body's first line of defense against infections that can cause diarrhea, such as the stomach flu or bacterial infections like Clostridium difficile. However, as we grow older, our immune system may not be as efficient in warding off these infections, increasing the susceptibility to diarrhea. Thirdly, older adults often have to take multiple medications for various health conditions. Some of these medications can have side effects that disrupt normal bowel function, leading to diarrhea. Antibiotics, laxatives, certain blood pressure medications, and chemotherapy drugs are some examples of medications that can cause this issue. Lastly, underlying health conditions common in the elderly, like inflammatory bowel disease, irritable bowel syndrome, diverticulosis, diabetes, thyroid disorders, or gastrointestinal tumors, can predispose individuals to episodes of diarrhea. These conditions can disrupt the normal functioning of the gut, making diarrhea a more frequent occurrence. These physiological factors make the elderly more susceptible to diarrhea and its complications. But that's not all. Let's explore the medical reasons next. Now let's delve into the medical reasons why diarrhea can be harmful for our elderly population. Firstly, dehydration. Diarrhea can lead to excessive fluid loss and electrolyte imbalances, especially in older adults who may already have reduced fluid reserves. This can quickly become severe, leading to complications such as kidney dysfunction, electrolyte disturbances, and cardiovascular issues. Secondly, electrolyte imbalances. Diarrhea disrupts the balance of essential electrolytes in the body, such as sodium, potassium, and chloride. Elderly individuals are more susceptible to these imbalances, which can cause symptoms like weakness, muscle cramps, and irregular heart rhythms. The third medical reason is malnutrition. Prolonged or severe diarrhea can interfere with nutrient absorption, leading to deficiencies in essential vitamins, minerals, and electrolytes. This can weaken the immune system, impair wound healing, and contribute to overall frailty and health decline. Fourthly, diarrhea can increase the risk of falls and fractures. Dehydration, electrolyte imbalances, weakness, and dizziness associated with diarrhea can make elderly individuals more prone to falls, especially if they are already frail. Fifthly, infections and sepsis. Diarrhea caused by infectious agents like bacteria or viruses can lead to systemic infections, sepsis, or septic shock, particularly if the individual's immune system is compromised or if prompt medical attention is not sought. Lastly, let's talk about medication interactions. Some medications used to treat diarrhea, such as anti-diarrheal agents like loperamide, can interact with other medications or underlying health conditions in older adults. This requires careful monitoring and adjustment to prevent adverse effects. These medical reasons further emphasize why it's crucial to take diarrhea in the elderly seriously. To sum up, diarrhea in the elderly is a serious concern due to several physiological and medical reasons. Aging brings about changes in digestion, weakens the immune response, and makes one prone to medication side effects and chronic conditions that can trigger diarrhea. Moreover, diarrhea can lead to dehydration, malnutrition, increased fall risk, and severe infections. It can also interfere with medication efficacy. Remember, early recognition and treatment of diarrhea in the elderly can prevent complications. So stay informed, stay vigilant, and help keep our elderly loved ones safe. Having understood the gravity of diarrhea in seniors, We should now focus on the ways to manage and prevent it. 1. Hydration. It is of utmost importance to encourage our elderly loved ones to maintain an adequate fluid intake. This can include oral rehydration solutions if needed, to prevent dehydration and electrolyte imbalances caused by frequent diarrhea. 1. Nutritional support. Offering easily digestible, nutrient-rich foods and beverages can play a vital role in replenishing lost nutrients, thus supporting overall health during and post-diarrhea episodes. 1. Medication review. It's crucial for healthcare providers to review the medications of elderly patients periodically. This is to check for potential side effects that might induce diarrhea and make necessary adjustments. The addition of probiotics or dietary fiber supplements may also be beneficial for certain individuals. 1. Infection control. Practicing good hygiene, hand washing, and infection control measures can significantly reduce the risk of infectious diarrhea, especially in institutional settings or among older adults with compromised immune systems. 1. Medical evaluation. If diarrhea in the elderly persists or becomes severe, it should immediately prompt a medical evaluation. This helps to identify underlying causes, rule out serious conditions, and initiate appropriate treatment. As part of the diagnostic process, laboratory tests, stool cultures, imaging studies, or endoscopic procedures may be recommended. Remember, prevention is always better than cure, so let's take proactive steps to ensure the health and well-being of our seniors. That's it for today's video on diarrhea in the elderly, a hidden danger. We hope you found this information useful and that you'll use it to ensure the well-being of your elderly loved ones. If you'd like to keep learning with us and stay updated on important health topics, please consider subscribing to our channel, Medicine Health 360. If you found this video helpful, don't forget to give it a thumbs up. We'd also love to hear your thoughts and feedback, so please don't hesitate to leave a comment below. Remember, your health is our priority. Stay informed, stay healthy, and we'll see you in the next video.